All right, Jeff, thank you very much. Turning now to the state of our nation. A Senate committee passed a sweeping bipartisan bill that tackles a wide range of big-ticket health care concerns. The legislation aims to prevent surprise medical bills, lower prescription drug costs, and raise the nationwide tobacco purchasing age to 21. Washington correspondent Jesse Tenor reports what hurdles could stand in the way of one of the only major health care bills that stands a chance at passing Congress this year.
You'll never get another surprise medical bill for that reason.
Congress and President Trump want to take patients out of the middle when it comes to the unexpected and often pricey charges from a provider that is not in their insurance network. But leaving it up to the doctors, hospitals, and insurance companies is where the agreement ends.
At first, I thought since the problem was out-of-network doctors, just put them all in network. That didn't work that well.
Tennessee Senator Lamar Alexander says the general consensus among Congress to stop surprise emergency bills now seems to be moving toward a benchmark payment system based on the median price of in-network doctors in the same area.
So what a doctor gets paid in Alaska will be very different from what a doctor gets paid outside Miami.
Louisiana Senator Bill Cassidy supports the benchmark, but worries how it's set by an insurance company with no input from doctors or hospitals. So his bill takes it one step further.
It does leave an arbitration at the end so that the arbiter can look, is this fair?
Their colleague, Tennessee Senator Marsha Blackburn, worries these changes could still harm reimbursement rates for rural hospitals.
We want to help them keep those doors open and make certain that there is access to that care that is needed in our rural areas.
Alexander says discussions will continue in the weeks to come to make sure there are no unintended consequences. He hopes the Senate will send the legislation over to the House before the August recess. In Washington, I'm Jesse Tenor.